use this knowledge to redesign national systems to minimize adolescent health inequalities. So I would like, first of all, to give the floor to Susan. Susan, to share your thoughts about this use of knowledge and the redesigning processes. Over to you.
Thanks, Hoff, and thanks, Danielle, for a lovely presentation. And I think it's really interesting to see how these presentations are fitted so well together in terms of that notion of inequality at a country by country level and then within a country. So I suppose I would like to take that big picture view first and really think about the role of poverty reduction and thinking about the sorts of social welfare policies that need to be put in place. That in so many countries, we've been lucky enough during this COVID pandemic to appreciate the impact of, in Britain, for example, I know you call it the furlough scheme. We've got a different language about it in Australia, but basically the level of unemployment benefit that is otherwise paid to people is much, much greater during COVID than it would be if otherwise people were unemployed. And I think that this has been so critical in terms of reducing poverty and promoting family health and well-being. So other, if you like, taxation levers, employment levers, welfare, financial benefits to families, not just with young children, as some countries provide financial relief, for example, to families where there's children under 5, under 10, under 15, but I would argue, under 21. And I think through those sorts of poverty reduction approaches, we know that we are also promoting gender inequality, if only that we know that the wealthier countries, and it's been studied well, that wealthier countries have less gender inequality, that in terms of some of the particular health impacts, both for men and women. So these aren't just in terms of negative impacts on women in terms of sort of hegemonic notions of masculinity, which are so damaging to men as well as women, but reducing gender inequality is important. And I think if there's one other thing I would say, so my second point would be about thinking differently about the role of schools. And again, in this pandemic time, I just really want to come back to how much we've learned about the importance of schools in terms of sites for learning outcomes. And I know that those of you in the UNESCO framework are absolutely focused around the importance of schools in terms of what they achieve in terms of those outcomes that promote quality learning, which is so important in terms of future economic income for us as individuals. So on one hand, it's thinking about promoting those core building blocks within teacher education that promotes better quality teachers, but also then recognizing the broader role of schools as social communities where young people meet, in which health, particularly mental health, in terms of well-being, is actually achieved within that social environment. And then again, I mentioned it on my last slide, but the notion of investing in workforce education and training as a mechanism of building critical mass, changing mindset. As a young doctor, I knew really nothing about adolescent health. I had no training whatsoever. I would like to hope now that the students that I train as medical students at the University of Melbourne or students around the world are in a very different position, whether they're going to be going into public health, whether they're going to be going into clinical roles, or whether they might be influencing policy development.
Yeah. Okay, thank you very much. And I would like to ask the same question to you, Danielle. How can we use this knowledge for our national systems?
Yes, thank you, Goof. I said it's time to undertake some actions, and we already know quite a lot, but for starting, I think we have to prioritize where to focus on, because it's not possible to improve the whole system in one. So we have to take step by step. And By doing that, prioritizing the focus of change, I would suggest to involve the underserved populations. Involve the underserved adolescents in this case, to find out which health system barriers they experience. And we know the most common health system barriers, but we also know that in some cases they experience barriers that we don't think of, that are not in our mind. To know what really matters, I think we first have to start by involving the underserved adolescents. Second is that there are some countries and some populations. In our project, we call it the positive deviance. And these are also populations that, well, based on their description and definition, they are prone to be underserved. But they are not underserved because they receive the right care at the right moment. So there are some examples from, well, potential underserved populations that are not underserved, for example, for vaccination services. So we can learn from that and find out what happens in those populations so that these populations have a high vaccine uptake, for example. And the third point that I would focus on is the kind of research that we can do in order to, well, implement and evaluate health system changes. I'm a very big fan of participatory action research, which means that you try to implement something, an intervention in the underserved community. And you make the underserved community part of your research team and also let them decide what the preferred outcomes are. And then you evaluate what you are implementing, and together with the underserved community, but also with the healthcare professional, you try by improving in a cyclist, by improving and evaluating to come to the, well, best possible intervention. So these 3 points, I think we should start with.
Okay,
yes.
Thank you so much, Danielle.